part of the recording. Morning to everyone who's joining us. Harriet, do you have your hand up? Did you want to say something?
Sorry, no, I've pressed the wrong button. Sorry. I was trying to write out. My name was there. Sorry, I'll now take it down.
No problem. We're glad to have you join us. Thank you to everyone who's coming in. As you can see, the recording has started. So by being part of this, you've given your consent to be part of this final Africa Biodiversity Collaborative Group Population Health Environment webinar. This is the third in a series, and we're very, very excited for our program today. For those of you who don't know me, my name is Janet Edmond, and I work for Conservation International. And we have been part of ABCG for a very long time now. So let me just share my screen first. I'll just give you an overview of ABCG for those of you. Can somebody just give me a verbal heads up that you can see the presentation?
We can
yes,
now.
please. We can.
Okay. Great. So again, let me just give you a little overview of ABCG. For those of you, I think most of you on the call know ABCG. This is a very unique platform, and those of us who have been involved for a long time really appreciate the fact that this space allows these 7 conservation organizations to come together in a non-competitive way. To really increase our collective impact for conservation, to really bring all of our expertise and approaches and the different ways that we work together and with the communities that we work with, and to really be able to bolster biodiversity conservation. We are supported by the U.S. Agency for International Development and the Bureau for Africa, so we owe them a great gratitude. As I said, we are a coalition that convenes, collaborates, and co-creates, and all of this is, for the greater good of biodiversity conservation in sub-Saharan Africa. Just a note, I've said this is our final webinar. The current agreement that ABCG has with USAID is coming to an end, and the coalition is going to transform and scale up and have much broader reach and ownership in Africa coming. So you'll hear more about that and how we work. We definitely, like I said, work to share our best practices. We're all about generating and disseminating information so that it gets used and helping practitioners improve, scale, and replicate. And those of you who know ABCG know that we have different priority themes that we work on. This one that we're talking about today is links to global health, and the way that conservation and human health are inextricably linked. We can't really talk about these things in silos, and I think you'll see that today in the speakers and the presentation. So let's go to this Mentimeter exercise. If you guys can go to menti.com on your phones or on your computer and type in this code. It's 5450 7430. Come over here to the Menti. And if you can just mute yourself if you're not talking, that would be fantastic. So on your phones, do you guys see this question? What do you hope to learn today about PHE approaches in Africa? And if you guys can fill in, I think you get like three options of what you think you're going to learn today. Okay, we're getting some results coming in. Excellent. Best practices, some success stories, absolutely inspiring examples. I know we're going to hear that. And great. What comes next? Excellent. Great. Thank you guys so much for participating in this. I really appreciate it. I think you are not going to be disappointed. I think we're going to hit a lot of these issues. What has worked in PHE? Absolutely. Inspiration? Absolutely. And then the benefits of integrating. I think we're definitely going to hear about that. So let's go to the next question. So this is true, false, or I don't know, and you can be very frank. So PHE practitioners have sufficient tools and capacity to implement PHE projects. What do you guys think? Oh, that was fast. Okay. All right, good. I'm glad people are being very honest. They may not know. I think, okay, we've got a couple optimists who are saying that we do. That's great. Excellent. Okay. So this is an interesting spread, right? A couple of us do think that there are, and then some of us think we definitely need more. So, and for those who don't know it, it sounds like something that we can work on as well to be sharing more. So thank you guys very much for that. I appreciate that. And then here's our final question. In your experience, what one thing would help increase support and implementation of PHE projects? Are you actually, I didn't realize option 1, 2, and 3 were going to be there. Are you able to enter anything in there?
No, it's just a check, like a.
Oh, really? Okay.
Yes,
maybe from an adaptive management standpoint, since I messed up the question, does anyone want to shout out or offer something in the chat about what one thing would help us? Who's got that idea for option 1? What would you suggest?
So I see more funding in the chat.
Okay. That one's always a good one.
Dedicated funding, specificity here.
Yeah, good. That's precise. Sounds like from the last question, there's maybe a little bit more dissemination of existing tools and approaches that could be done to get it out to people who are interested.
So we have more innovative approaches, better evidence of impact.
Okay.
And we got a +1 on more funding and a +1 on better evidence of impact, increased advocacy.
Excellent.
This would be a really beautiful word cloud if it had worked.
I know. I'm so sorry. I'm so sorry.
Fine. Technology life.
Best laid plans, right? So thank you very much for that, for the additions. Okay, so now we can turn it over to our speakers, and here's just a preview of what we're going to see today. We have Paul Cowles, who's the Chief of Party for Jane Goodall Institute's USAID funded project in Tanzania, the landscape conservation in Western Tanzania, and then his partner Samuel Kagaro from Pathfinder is also going to share with us. And then we're really happy to have Justina from USAID Tanzania to give us her reflections. And then Stephanie's going to moderate our chat, and she and I have a couple of reflections to share with you as well. So I'm going to turn it over to Paul. And I'm just going to share my screen, and you can tell me how to click through. Is that okay?
That sounds great. Everybody can hear me all right?
Yes, absolutely.
All right, so I'm going to get started here, and then Samuel will take over when it gets hard, and we should be through this in just a few minutes. This is the Landscape Conservation Western Tanzania project, and it has both biodiversity funds and health or population family planning funds dedicated within it. Pathfinder is our extremely capable partner delivering on the family planning aspect of this project. And go ahead and go on to the next slide, and I'll give you guys a little orientation to LCWT. We have cute chimps in the landscape, which is extremely important. The landscape covers about 1.7 million hectares of land, stretching from the Burundi border, you see up there in the north and to the left, and all the way down to a town called Mpanda, down a lower right corner of the landscape. What you don't see there is outside the landscape is Mahale National Park, which is the other large protected area with chimps in it. This is a fairly inaccessible landscape. We can get around in it, but we can't get everywhere. And it has populations that are extremely isolated. Let's go ahead to the next slide. So landscape conservation Western Tanzania, like many biodiversity projects, is a lot about integration. And we're integrating multiple sectors here, but really mostly in the service of biodiversity and trying to conserve biodiversity. And so we've got a component of governance, improving how villages and districts manage their natural resources. And we've got a component on family planning, of course, which Samuel will talk to you about here shortly. We've got some livelihoods aspects to the project, trying to change the way people use the land. And all this is sort of tied together through our land use planning approach that pulls together villages to identify, which areas of their villages they're going to use for what. So they'll have ag zones and they'll have settlement zones. And very importantly for us, they'll have natural forest zones as well. And these village forests contribute to the integrity of chimpanzee habitat in this area. We have a significant population of chimps in the region, and so that is basically the project in a nutshell. And you can go on to the next slide, and I'll let Samuel take over.
Yeah, just to give you a background of where we are working. This project is working in Tanzania, where our population is now close to 60 million after 60 years of independence, since 1961, when we got independence, when we were around 10 million. Our population has grown up to close to 60 million in the span of 60 years. So Kigoma region is one of the regions. If you go to the next slide. So as the slide is coming, so Tanzania is just 5th in Africa in terms of population, just next after Nigeria, Ethiopia, Egypt, and DRC. So it's very highly populated country. So distribution of our population, as you can see, the pyramid on your left, we are a very young population here. Most of them are just below 20 years. So if you see this distribution of population, it is mainly young people who are dependent on their adults. We have more young people and less productive age. So it's hard to get that called demographic dividend. We have very few people who are engaged in income generating activities compared to young people below 15 or below 20 years. And our total fertility rate is very high. Currently, it is standing at 5 children per woman, while globally it's 2.3. That's the global estimates. But in Tanzania, we are 5 children per woman. This is even higher as compared to Africa estimate, which is 4. Africa is around 4.3. So we are one of the countries with very high fertility. Again, this varies from region to region. Where we are implementing our project, it's more than 5. It's more than 5. On average, women give birth to 6 to 7 children. That's in Western Tanzania, areas of Kigoma and the Katavi. You will see the 2 regions on your map. This is where the landscape is. share percent pregnant. So you will see the area I didn't highlight, the Katavi region and the Kigoma region. Katavi region is the one of the highest rate of adolescent pregnancy. So if you want to do fertility or you want to increase access to family planning services, this is one of the area of high priority because teenage pregnancies, underage pregnancies, very high, highest in the country. 45% of adolescents in this region conceive. Next. Yeah, so our theory of change for this project, we want to build, resilience of these families with the assumption that when people in this area have services, it will help to improve their food security, access to education, better education in those families, but also importantly, they will have improved livelihood because we also provide linkage to livelihood services, as Paul mentioned earlier. People who are getting family planning services, they are also linked to other livelihood opportunities. So this will help to build their resilience and can help to engage in conservation. Some evidence from midterm evaluation which support that the clients who are engaged in family planning services are more likely to adopt NRM and conservation interventions. Yeah. So as part of this project, we have three main intervention areas. We work through first community health workers. The project, in this project, there are 104 villages, and we have at least 2 CHW in each of those villages. So we use these community health workers who are also conservation champions. They are also family planning champions who are involved in provision of family planning services, but also they link beneficiaries to conservation opportunities. So this is one of the key things that we are doing by using community health workers. These are local people from the local villages, so they're involved in provision of family planning services. In this country, the CHW are only allowed to give two kind of contraceptive methods, contraceptive pills and condoms. So when clients opt for other long-term methods, CHWs give them referral to the health facilities. So the project is also supporting health facilities in these villages. So these villages, they have dispensaries and health centers. This is first level, lower level category of health service provision. So the CHW provide that link to the health facilities, to clients who opt for other long-term contraceptive methods. So they also link them to conservation units like community conservation banks. We have this is called COCOBAs. So this is where people are putting their money, they save, they get capital to start their small businesses. The third intervention which we also do, we do community outreach services, where our team goes into the villages to provide services. This is a team of trained healthcare workers. They go into the village, they provide long-term and permanent methods in those remote places which are not otherwise reached by the health system which is there. So we provide those outreach services to clients who wanted to access long-term contraceptive methods. So there are people who could not make it to the health facilities. We go into their villages through outreach services. So those are the three main interventions which we provide, and these are integrated. We provide link to other conservation activities. Next. Yeah, so what we have achieved so far, I mentioned about the 3 interventions. We have managed to generate the couple year of protection of 154,000 so far in the 3 years of the project. Maybe one thing that Paul didn't mention, the project is at the end of year 3. We started back in 2018, 2019. Most of the activities started in the 3rd quarter of 2019. So we started back, we are in the year 3, going to year 4 next month. So far, we've generated a CYP of 154,000, and the project has recruited about 308 HW on average of at least 2 in every village. So every village we have a champion. He's a family planning champion. He's a conservation champion who is providing family planning services, but they also link to other conservation services. The project is also supporting 74 health facilities. These are the facilities which are actively now providing family planning services. And the total number of people who have accepted family planning methods so far, it's about 100,000 people. And the number of beneficiaries who are implementing conservation in these areas is over 31,000 people. So these are the people who received our services, and they've joined various conservation efforts, including cocoba, beekeeping, tree planting, nurseries, and other interventions. Next. Have the slide moved? Yeah. So what are the keys to our successful integration? We are planning together as a team. So this project has 5 IRs. The first one is focusing on governance. The second one is focused on land use planning, monitoring, family planning, and the behavior change communications. So all the 5 intermediate research teams, we are planning together and we are sharing information. We are sharing ideas, we are sharing resources, because one of the value of integration is to also be cost effective. And we are also monitoring and doing evaluation together. So this project, through these integrated interventions, we have got more people, men and women, who are involved in family planning services, more men who are involved in family planning, especially we have a large group of men who are CHWs. We have women, more women are participating in family planning, but also participating in conservation, because majority of members of the cocoba groups are actually women. So we have more women getting an opportunity of income generating activities and livelihood opportunities in cocoba groups. And yeah, so it will help to build their resilience and have better families. So in a nutshell, that's all that I wanted to share. Next. Yeah, so thank you very much. Welcome for question and answers if you have one. Thank you, Janet.
Thank you so much. That was fantastic. And I think those people that were looking for those best practices and inspiring stories at the beginning have found some. I'm going to leave the presentation up and turn it over to Justina, if that's okay, just so I don't have to go back and forth. So I'll invite Justina to give us her insights from working with this project for these couple of years.
Yes, good morning, good afternoon, everybody. As I was introduced, I'm Justina Kimbesa, and project management specialist from USA Tanzania. And I'm also the agreement officer representative for this project on USAID side. So I'm supposed to be talking about USAID perspective on PHE and conservation benefits. So far, 2 speakers have said we have started seeing some benefits, integrating the 2 funding together in one project. But this came as USAID commitment to strengthening population health and environment outcomes for sustained future of Tanzanians. And that's why we came up with this project, with also understanding on the unique role that women plays as good custodians for conservation. So USAID is supporting both women's and family health by increasing access to family planning services and information for communities to determine ideal family size. And by doing this, we think this will allow women to express, their reproductive choices and also engage in natural resources management and biodiversity conservation. And the other thinking behind was because most of our project or biodiversity and NRM projects are in very rural and remote areas, and our communities there are mostly disadvantaged to some of the services, especially family planning. So thinking of combining two projects, because we are originally there already, protecting chimpanzees for this project in case, and also, biodiversity conservation. So we thought adding up this project first would save costs, but also, increase services to unmet demand of family planning. And also, as Samuel has mentioned, that we are starting to see clear connection between family planning and conservation, because most of the time and communities, when the project goes there and ask women, can connect, having healthier family or, ideal family size and conservation. And because couples and women who have, opportunity to have choices on their reproductive health, they are more likely to also take care of the environment in a sustainable manner. And this means that it reduces demand for natural resources and to cater for their family and a livelihood. And as I mentioned, the increased knowledge is seen among communities, linking conservation and family size, and particularly linking the family size and the use of natural resources management. And this also the link between healthier family or child spacing and also economic empowerment, knowing that family planning is enabling women to participate in more lively activities. For example, a woman will say, before I was introduced to family planning, I was having a baby after a year and a year, so I wasn't having enough time to participate in economic activities. And that had led to those kind of women to just go in the forest and do whatever they can do to cater for their family need. But now, after spacing kids or children, then they have enough time to go and do do economic activities, by particular farming and other, maybe start a task shop or do something else that will increase more income for that household. And this has been a motivation for even husbands now to support family planning, because they see how their wives have benefited from family planning. So in that is a nutshell, I can say how USAID sees the links between family planning and biodiversity conservation, natural resources management, and also why, as USAID, we decided to design, because this is one of the projects that is integrated within USA Tanzania, but it's the first, for USA Tanzania to integrate family planning and biodiversity earmark funds from the beginning. Thank you.
Great. Justina, thank you so much for those remarks. There's so much in what you just said that I think we can pick up in the question and answers. And I just want to especially thank you and Jane Goodall for being part of what they called a speaker pitch at World Conservation Congress the beginning of the month. That highlight on this project and these benefits of this approach, I think it was pretty unique. I don't think there were maybe 4 or 5 things on population health environment at that conference, and the video and the poster that we did, I think, garnered a lot of attention, and we're currently trying to dislodge it from the site and make it public, so stay tuned for that. So and then I'm just going to share as we close out ABCG and we close out the work that we've done on population health and environment, I'm just going to give you a couple reflections, which Natalie Simano from World Wildlife Fund US, who works with World Wildlife Fund Cameroon. That was our presentation in August. We really, at the end of this work over the past couple of years, see that we have leveraged support from existing PHE networks and practitioners. Many of you who are on the call have really contributed to the work that we've done. And I do think that we have influenced practitioners. You heard about how now Conservation Measures Partnership has PHE as an approach in their library, which is a pretty huge achievement. We have been increasing momentum for these types of approaches. What we've heard today really gives us a lot of evidence to be able to advocate to our colleagues in the conservation community about the importance of these approaches, and then also to gain support on the health side as well. And we really do think that these things, help us meet a lot of the Sustainable Development Goals, which are very much linked. And then just the point about the roles of men and women is really, really important. We tried in this phase of ABCG to really be looking at these differences and share best practices and knowledge with other parts of ABCG, like on climate change and land use planning. The work that we've done under the Freshwater Conservation and WASH does have, a gender element to it. So we do feel like we've made a little bit of progress in that way, probably have a lot more to go. And then just, again, this was from last webinar to say that resilience really underlines a lot of these principles that we're talking about. And we really do think that PHE, is a strategy for resilience. So I think we'll turn it over to questions now, and I will get out of the presentation and stop sharing. And I will turn it over to Stephanie, who was going to moderate our Q&A, I believe. Oh, and we already have a hand up, I see.
We do. We already have a hand up. We also have some questions in the chat box. So if you want to either raise your hand or put questions in the chat box, and I will read them out. But Rose, since you raised your hand, do you want to go first? Just have to unmute yourself. It should be up towards the top right corner usually. Yeah.
All right. Thank you, team, and thank you very much. My name is Rose Kimanzi from Kenya, implementing a PHE program in northern Kenya. And my question is, thank you to USAID representative, and I'm asking whether USAID is extending the support to PHE approaches, so projects in Kenya as they are doing in Tanzania, because as Communities Health Africa Trust, a CBO, which is supported by TNC, we are implementing in northern Kenya, but the demand is quite high, and the disadvantaged communities are still demanding the integration of services. So is there any financial support or extension of USAID support to Kenya in particular? Thank you.
Okay. Yeah, thank you, Rose, for your good question. And what I can say, the current support is just within Tanzania bilaterally, and we cannot extend to Kenya. But perhaps maybe there could be opportunities because we always talk with our counterpart in Kenya and ask about that. But I cannot make any promises because that should be decided between Kenya Mission and Kenya implementing partners. Over. I don't know if I've answered your question.
Yeah, thank you. Thank you. Thank you, Janice. And we can just have a side chat on the same. Thank you so much.
Okay.
Thank you, Rose, for your question. So one of the questions we have in the chat box, and I'm not sure about this, but did your team integrate other health issues, including COVID-19, or have we just been focusing on reproductive health and family planning? And so that is to Samuel and Paul.
Yes, we are integrating with other health. For example, first of all, we are integrating with conservation. This is key. The first thing is integration with other conservation approaches. But in terms of other health services, sometimes we have teams which are doing immunization, especially during family planning outreach services. So when the team is going out for outreach services, those mothers who are coming to our outreach clinics, they also get a benefit of getting other immunization services. So we integrate with especially immunization, not COVID. This project is not doing any COVID thing. So we are just taking precaution for our staff, making sure that our staff are observing all preventive protocols while out in the field. And we are also protecting CHWs who are doing family planning services, make sure that they have their mask on and the sanitizers. So no COVID interventions, it's only family planning and occasionally immunization clinics integrated in our outreach services.
Yeah, we only have a family planning fund. Those are the only funds available to us for these health interventions. So yeah, it's very much focused on that.
Yeah.
Great, thank you. So the next question, and this is also to the JGI team, is how are Pathfinder and partners supporting MOH and others to sustain the program interventions beyond the project?
Yeah. Sustainability, this is one of $1 million question of these projects, but we are doing our best to ensure that these services are able to continue even after the project has ended. I will refresh you with the 3 interventions that we are doing. For example, community health workers, we are using local people from the local villages. We have trained them. They will have that capacity to continue providing these services even beyond the project period. So we have trained CHWs. We hope that capacity will remain in the villages for a long time. They will continue. Actually, we inherited some of the CHWs who were trained back in 2012 by our other project, which was supported by JGI. So that capacity will remain there. And the way we are working, these community health workers, they report direct to the local government. They don't report to us as JGI or Pathfinder direct. They have dual reporting. So when they compile their work, they send a copy to us, but they also report. We have created a mechanism that they have their supervisors, who is a local staff employed by the government, so that even when the project is out, that system will continue. That's one area. The other intervention that we are doing, I told you it was outreach services. So these outreach services, they are not entirely made up of our project team. We use staff from the local dispensaries, from the local government. So financing outreach services, yes, we advocate for that. Government to continue setting some funds for outreach services, especially in areas where there are no dispensaries, no health facilities. So that one, we also think it's a sustainable way because we are not relying on project staff, but local government staff who are doing these outreach services. And our third intervention was focusing on the health facilities. We are building capacity of health facilities to through training, on-job training and mentorship on how to provide family planning services in a quality way. And actually, even the reporting system, we don't have a separate reporting system. We are using data from the National Health Management Information System. It's called the DHIS. So we are sharing that capacity with the local government. The reporting system is through the government. The HR system, we are using the government staff. And we hope the model of service that we are doing is sustainable, really, because we are very much relying on the structure which is already present there. So we are just strengthening, doing some additional here and there. For example, talking of supplies, you cannot talk about family planning program without commodities. So all the commodities, majority of the commodities are centrally from the government. As a project, we do some gap filling, very few gloves here and there, you know, these small supplies, but contraceptive medicines, they are all from the government. So we are hopefully that we are working very well to ensure that there will be continuity even after the end of this project. Thank you.
That's great, Samuel. And to add on to that, there is actually a specific question about the supply chain for family planning supplies. And I'm not sure, Robin, if you want to come off mute and expand on your question, but I'm not sure if you're talking about like whether there's been supply chain issues, you know, given like the global supply chain issues we're all facing, or if you're specifically wondering like what Samuel was talking about, like where the supplies are coming from and how the supply chain works for this specific project.
You know, similarly in Kenya, most of our partners get all their supplies from KEMSA and the Ministry of Health, but there have just been a few supply chain issues recently, and we're not quite sure. I know KEMSA have got some issues, but I'm not sure if, you know, the cutting planning by the UNFPA, their reduced grants is feeding through into supply chain problems. It's been interesting to know what it's like in Tanzania.
Yeah, in terms of supply chain, yes, we are getting all our supplies from the medical stores department, which support all these vertical programs like family planning, HIV and malaria. They are funded by, is it Global Fund? So at central level, they receive that support from the Global Fund and other bilateral partners. But down in the district and the regions, we don't experience stockouts of family planning, especially family planning commodities. We don't experience frequent stockouts. Yes, there will be challenges with the distribution. Facility A may have oversupply, while Facility B within a local area have a shortage of some supplies. So the project support redistribution of these FP commodities and supplies. We rarely experience stockouts, complete stockouts of family planning commodities. In terms of other supplies, the project, yes, is procuring some supplies to support, especially during outreach services. But so far, I think the support from the government in terms of family planning supplies has been very good in the past 3 years of project implementation.
Great, thank you.
Thank you.
So I think this other question, Janet, is to us. And the question is the project now ending or continuing? And so I'm wondering, are you, to the person asking the question, are you referring to the PHE project, the task group under ABCG? Because LCWT is midway through, so it is continuing. And if you are referring to ABCG, if it's ending, how will our activities continue, and will it impact the benefit? Will impact and benefits be sustainable? So I guess just clarification from the person who wrote the question.
Hi, it's Harriet Gordon-Brown speaking from Chase Africa. I was meaning actually the project in Tanzania.
Okay, so it's midway through, so yeah,
right.
So it's not ending yet.
Okay, so it's a 6-year project, or it's halfway through a 3-year project? I wasn't.
Yes, it's actually 3 years into a 5-year project, so 2 more years.
Okay, thank you.
Fantastic.
Maybe can I just ask if this experiment, since this was the first time you combined at the USAID level the family planning and the biodiversity funds, are those lessons for how that's been working and the benefits that you're now seeing come out of the project? Is that being shared within USAID? Because that kind of meets our ABCG goals as well, to promote this approach. So I'm just wondering, Justina, can you talk a little bit more about, are you talking it up to your colleagues, and if you're finding resistance, or if people are open to this?
Yeah, internally we are sharing those lessons, because we are keeping being asked by USAID Washington, like, why do you combine these fundings, and you have to provide justification for that. So there have been evaluation conducted. We are still waiting for final report, but preliminary results have shown increase in knowledge and understanding on the linkage between family planning and conservation outcomes. So unfortunately, we haven't designed impact evaluation for this project to understand or to have a clear understanding on how family planning impacts conservation outcomes. But we are collecting as much information as we can while we are doing this implementation. So by the end of the project, we will have enough knowledge and also information on how designing a project combining biodiversity and family planning could bring more outcomes in conservation. Over.
Great, thank you. And I do know Elon's comment from University of Rhode Island Coastal Resources Center. She is saying that, I think back in 2010, 2012, they did have the USAID funded Pawnee project, which was a little bit north of Dar, right? Which did integrate biodiversity and family planning. So it would be interesting to kind of compare and contrast those experiences. Maybe we have a grad student who could do a little work on that, or somebody who wants to take that on.
Anyone on the call have extra time? And Rose, I also want to make sure that you see the chat that Clive has put his contact information in to reach out to him. Does anyone else have any other questions? Feel free to raise your hand or write them into the chat.
I would love to get people's thoughts on the gender aspects of this. All of the panelists talked about the importance of paying more attention to the role of men and women in this integrated approach. And if people are seeing, really promising initiatives or ways that we can continue to highlight this as part of the approach, I think it very much fits with the SDGs and USAID's framework on local capacity and all those things. So does anyone want to share?
Paul or Samuel, if you are talking, you're on mute.
Yeah, so in terms of gender issues, this project has given us an opportunity to get more men involved, especially in family planning services. Looking at the group of CHWs whom we are having, majority of them are men, and men are the ones who are lagging behind in terms of family planning uptake. So we have engaged more men as champions of family planning so that they can help to promote family planning uptake in their local villages. But in the other aspect, this project has provided more opportunity for women, especially to income generating activities. When we are connecting them to I mentioned about COCOBA, community conservation banks. These are local savings group for women. It's an empowerment for women. They get opportunity to save money and they getting their capital for their small businesses. So in the aspect of gender, I see that opportunity coming out of this project.
And just to add on to that, there's a follow-up question from Robin about what conservation activities the women are involved in.
Yeah, and it goes across the board. We have women on our village land use management teams, so they can be involved in that way. Probably the biggest livelihood activity and most successful one are the COCOBAs, which are the community conservation banks. And so those allow women to gather into small groups for a year, basically pool their money, loan it out, and do sort of short-term, environmentally friendly money-making projects. And so sometimes that can be around sort of helping them with sometimes sales of fisheries, sometimes around agricultural products and seeds, sometimes around could be beekeeping, could be mushroom collection, lots of different things. But they're really ruled by this rule that it has to be sort of an environmentally friendly money-making activity.
Fantastic. Another question that came in is family planning in connection with conservation can be a controversial topic. Did we find any resistance to the project at the local or national levels? And if so, how did we deal with it?
Local issues we've seen, but yeah, we made it very clear that the project is not about reducing population levels, not about reducing birth rates. It's really about family planning as a tool to stimulate families to be more resilient. So go ahead, Samuel, about resistance.
Yes, the only resistance part of the project is on family planning uptake, especially, we are working in areas with a mixed population. We are working in Katumba and Mishamo. These were the former refugee settlement areas, and this is a place where we have very large population. These camps were located, unfortunately, in the mid of the thick forest, the Tongo East and the Tongo West forests. And these are the areas which are chimps. They are also, there is a large number of chimps in those areas. So these are the areas where the refugees, they are resistant somehow to family planning uptake because they have their mission of going back to Burundi, in large numbers and the other things. So these are the underserved population, and they are less likely to accept family planning services. So yeah, so that's the kind of the resistance which it was also documented during midterm evaluation that yes, acceptance is high in some areas, but around the refugee settlement areas, it's still a challenge because they are disconnected families and the people have they have what is called a mission on population compensation. So when you introduce topics of family planning, you really have to counsel them and educate them for them to act. Yeah, so this is one piece which is really we are facing some challenges, but we are coming up with an innovative way to increase uptake in that area. As Paul mentioned, there have been questions especially when we have meetings with the local government. You guys want to give us contraception in favor of the chimps? We say, no, this is not the aim of this project. It's not about population control. It's about building their resilience so that we help to conserve together.
Thank you, Samuel. I think that last point is especially important when we look at integrating conservation in these efforts, because a lot of times the question becomes what the goal is. Like, is your goal only to save the chimps? Then why are you doing this? So it's always important to have those conversations. So Alice, who's an insider from JGI, has a question. She wants to know if any youth outreach activities on PHE have been conducted.
So youth outreach activities.
Oh, youth outreach services. Yes, during our presentation, you saw that teenage pregnancy is very high. Yeah, so our approaches has always targeted, I would say, invested in youth. We have the youth-friendly clinics in these areas, and last year we conducted training on adolescent sexual reproductive health training to providers so that they learn how to provide youth-friendly family planning services. So not a particular project targeting youth, but our family planning services we've designed in such a way that it is youth-friendly to increase uptake of family planning for youth. So I would say it's just in that shape.
Thanks. And I'll add just a little bit to that. So part of my job is working with the Roots and Shoots program for GHI, which is our youth program. And across kind of all the landscapes, one of the priorities is increasing girls' leadership and retaining girl retention in school too. So that's something that we do across all of our programmings. So in addition to this, and then I think this will have time for maybe one more question, and I'm going to go to this one that's directed at USAID, and it says, I know that family planning is important and among the priority of USAID, but I'm wondering for the neglected tropical diseases currently among issues in many African countries and linked to environmental aspects and climate change. So I think they're just kind of wondering what USAID's approach is on other neglected tropical diseases. And then they also had a question about what USAID thinks about the One Health approach.
So far, I come from Economic Growth Office, and health programs are heavily managed out of Health and Population Office. But I have a knowledge of there is One Health program and initiative that USA Tanzania is working on. But also on neglected diseases, I understand there are a couple of projects that USAID is funding through different IPs. I cannot tell much because I don't have enough information. But perhaps if you want to find more, I had put my email on the chat, then you can write me directly, then I can reach to our health office for colleagues for more information and respond to you. Thank you.
Great, thank you, Justina. There's a question about whether we can share the link for the midterm evaluation. Paul, I don't know. I don't think we have the final one yet anyways.
Yeah, we're still working on a draft right now, apparently.
Yeah, so definitely not right now, potentially in the future, we will see. And then Rose had a question about how we're reaching youth in school and what's the policy on family planning on school-going girls. I know, Paul and Samuel, do you want to address that, or would you like me to, or?
Yes. Yeah, we have Roots and Shoots clubs. These clubs have been focusing on the environmental conservation. We also have some reproductive health topics linked to these Roots and Shoots clubs. So they can get the information about their reproductive health because the policy here is not very friendly to youth, especially because, I would say they get that information through Roots and Shoots clubs, and they can get linkage to planning clinics. They get stigmatized when they go to the health facilities, you know. That's why we do training on adolescent reproductive health to providers so that the facilities become more accepting of the young girls and boys who are going for family planning services. So we work through Roots and Shoots clubs for their linkage to reproductive health messages, not necessarily focusing on family planning, but broader RH issues.
Yeah, maybe I can add on what Samuel has said, general understanding of family planning services in schools. As he said, police doesn't allow to provide family planning services in youth in schools. They are still regarded as kids. But as he mentioned, it's allowed to provide sexual and reproductive health education. So there is an opportunity to talk to these youth in schools about their sexual and reproductive health. But I do understand partners are coming up with innovative idea for more youth-friendly services. As he mentioned, somebody mentioned, like, due to African culture and a young person to go to ask you for family planning, then the nurse will probably, who knows, the mother or the father will say and said, oh, have you started practicing sex at your age? Why do you want family planning? But still, education it's being done to these health service providers sorry, I skipped that word, to, you know, have a more friendly services to young people, and also try to provide these services during the time where other, you know, big grown-up women are not there, because sometimes these youth cannot go there because, you know, being afraid, if I go, maybe my mother is there, my aunt is there, and everybody from my family will see me. But having this innovative or time which they can cater for young people, then more people can be, you know, motivated to use family planning through those channels. Over.
Janet, I don't know if you want to close this out, and also I'll just point everyone to the chat. Evelyn from ABCG posted a link where you can sign up to receive more emails from ABCG about webinars just like this one.
Great. Yeah, and I want to thank Paul, Samuel, Stephanie, Alice, Justina. Thank you everyone for making this webinar so fantastic and uplifting as our finale. And thank you very much to Evelyn and Elijah. Elijah's put the Twitter for ABCG Conserve, so follow us on social media. And just to Rose's question here, so this is our final webinar on population health environment as part of the current phase of ABCG, but you are going to be seeing soon that ABCG is transitioning from this current mechanism to a much broader coalition of Africa organizations. And we can certainly make sure that you're in the loop on that, Rose. The idea is that we've had many years of great lessons and collaboration, and now the idea is that this ownership of ABCG is going to move to more Africa-based, and it looks like Nairobi-based, but it is all of Africa-based. So we'll definitely keep you in the loop on that. And I certainly hope under the new phase of ABCG that these issues, which are so important, are going to still be a priority for them. I think we might have some advocacy to do on that front, but I think what you guys have shared today gives us a lot of evidence for our advocacy, and just showing how important this is all for the communities in which we work, and for biodiversity, for the chimps and everybody else, right? So with that, we'll close this out. We'll raise a glass to ABCG and all of the people who joined us this summer in our series. We're so glad to see you all, and thank you very much for all your collaboration and partnership. And we will hopefully see you soon in other venues. So
Thank you.
Thank you.
Thank you.
Thank
Thank you, Janet.
thanks, guys. Rose, I hope you get those emails
Thanks,
from the
Janet.
chat, right?
Yes, and we can get in touch, Janet, and discuss more on that.
Yeah, absolutely.
Maybe you can you just type your email address in the chat just now, so that before fading out.
Glad you can see the chat, because sometimes I wonder if external people can see the chat. So
I'm seeing the chat.
okay, great. That's good. You never know.
Great.
Participation today. This is fantastic.